Good morning. This is Dana Parsons, and welcome to the LeadingAge Virginia Coronavirus Weekly Member Update. Today, we are going to be discussing masking guidelines in independent living in congregate settings. And we have today Linda Couch, Vice President of Housing Policy with LeadingAge, and Janine Feed-Boyle, Vice President of Regulatory Affairs with LeadingAge. And we are going to begin with Linda. So over to you, Linda. Thanks for joining.
Dana. And good morning, everyone. And Janine is here with me, so that's great. Hi, Janine. And so
Hello.
what I want to do is go through the new CDC guidance, so we're all sort of on the same page. And then I'm going to talk a little bit about what I understand the reaction, the response to be so far from affordable housing community members that I've spoken with. And we'll hear from Janine about what she's been hearing from other types of independent living settings. I have a couple of updates from HUD if that's of interest to people as well that we can talk about later. But for right now, here's a link to the new CDC interim public health recommendations for fully vaccinated people. Next slide, please. So the first thing that's important to understand is that this new CDC guidance that came out, these recommendations that came out last Thursday afternoon, are for non-healthcare settings. And so these will apply to independent living, including affordable housing settings. And what we've put on these slides comes directly from the recommendations themselves. We didn't write this, we just copied and pasted. The new recommendations are state that fully vaccinated people no longer have to wear a mask or physically distance in any setting. And here, this is a really important part, except where required by federal, state, local, tribal, territorial laws, rules, and regulations, including local business and workplace guidance. And so the CDC is putting out these recommendations for individual people, but local businesses and workplaces can go ahead and continue to have their own guidance. The CDC recommendations also say that fully vaccinated people can refrain from testing following a known exposure. So that's big news too. And again, workplaces, independent living communities can continue to have their own policies, but this is where the CDC science is at right now. Next slide, please. And this is from the recommendations as well, and this is just sort of how the CDC got there. They're explaining that vaccines are highly effective, that they do now have all this evidence. That frankly, we haven't heard a lot about that evidence, but the CDC is saying clearly in these recommendations that they do have all this evidence. And a growing body of evidence that suggests that fully vaccinated people are less likely to have asymptomatic infection or to be able to transmit COVID to others. And therefore, on the right side of the screen, they're able to say that indoor and outdoor activities pose minimal risks to fully vaccinated people, and fully vaccinated people have a reduced risk of transmitting the COVID vaccine. I think that's something we've all been waiting for the CDC to say for a long time when they had the science together on that. Next slide, please. And so in the next couple of slides, we're going to show you, we broke out a kind of a handy chart that's included as a link to the CDC's recommendations. And it's all about either resuming activities, refraining from activities, or continuing to do certain things. And you'll see icons in the chart that have a maskless face where prevention measures aren't needed, and then some of the other side of the chart has this icon of the masked person where unvaccinated people are going to be required to wear a mask, stay 6 feet apart, and continue to take other prevention actions. So next slide, please. And here you start to see on the right side, all the green, right? Fully vaccinated people can do all these things outside without a mask, and unvaccinated people can do a couple of things outside, but less safe areas. You get it dining at outdoor restaurants, least safe, attending a crowded event. Next slide, please. And then it continues with indoor activities. So fully vaccinated people, you'll see on the right, the people without the masks can go ahead, the CDC is saying, and do things like visiting a barber, hair salon, go to a museum that's not crowded, or an indoor shopping center, attend a full capacity worship service, sing in an indoor chorus, eat in an indoor restaurant. Participate in indoor high intensity exercise. And on the left, you'll see how those are less safe or least safe, even for those people who are unvaccinated. Next slide. The recommendation from last week from the CDC also go into and make some updates to the CDC's policies around what fully vaccinated people with COVID symptoms can do, and what they should be doing following an exposure. So, fully vaccinated people with symptoms, should isolate themselves from others. That hasn't changed, right? If you have COVID-19 symptoms, even if you're fully vaccinated, you should isolate yourselves from others. You should be clinically evaluated for COVID-19, and you should be tested. But fully vaccinated people who don't have any symptoms and who might have had who did have an exposure to someone who was suspected or confirmed, don't have to be restricted from work or don't have to be tested following that exposure, as their risk of infection is really low. And then finally, the recommendations say that fully vaccinated people with no symptoms and no known exposure should be exempted from any routine screening and testing programs if that's feasible. And again, these recommendations are for non-healthcare settings, and individual businesses and workplaces can set their own policies. And regardless of what the CDC says, state and local laws will still prevail if they are different or more stringent. Next slide. And then finally, there are some updates on travel. This has been an issue, particularly with staff traveling, about having to get tested before you come back to work. So for people traveling domestically, fully vaccinated people don't have to, the CDC is saying, don't have to get tested for COVID either before or after travel. And they don't have to self-quarantine following travel. So depending on where your state or local laws are, that is a new and very different scenario. And then for international travel, the CDC is still requesting that fully vaccinated people still be required to have a negative COVID test when they come back into the United States. Next slide, please. So I'm gonna before we turn this over fully to questions, I want to say a few things about what I've been hearing from affordable housing members, and then I'm really curious to hear from Janine about what other independent living providers are saying. So obviously, these recommendations just came out last week, and there is quite a bit of you've seen in the news. I think the biggest headline in the news this week has been confusion, right? What do I do? What am I supposed to do? And I think that's no different, for example, for affordable housing providers. We've heard a range of responses across the board. The first thing is that people are very aware of what their continued, regardless of what the CDC is saying, their continued state or local laws around masking, distancing. But on top of that, we have, I've talked to members who are not changing any of their policies right now. They say it's too soon. We don't want to jump the gun on this. We want to see how this is working out in the community. We're going to continue our masking, continue our distancing, continue to have closed whatever activities or community spaces we had closed last week. We're not going to use this as a triggering event to make big changes. Other affordable housing members have said this is the moment we've been waiting for, right? This is the moment where we say, okay, it really does matter that you got vaccinated. You really will get to change your behaviors, and have removed mask mandates in their communities. Have really opened up community spaces for fully vaccinated people, and for everyone. And that's the rub, I think, in affordable housing, is that because you don't know precisely and you can't ask if someone's been vaccinated, you open it up or you don't, and you don't open it up for fully vaccinated people, but you do make some signage and announcements and saying, if you're using the space and you're not fully vaccinated, you need to wear a mask. But you're not, you're not keeping track of that. You're not writing that down. So I would say that the response from affordable housing members has really been across the board. Everything from we're not changing anything to, we're going to change most everything. And we are going to make it clear that the onus is on the unvaccinated people to get vaccinated if they want to be able to, not wear a mask. They want to be able to go and play bingo. They want to be able to do these things. They're the ones that have to get the vaccine already. I wish I had something clear to tell you. We do not expect HUD to put anything out on this. HUD's been very much staying in the housing lane, and even with the new administration, they've been much more coordinating with CDC, but they're not going to step out in front, I don't think, of CDC and say this. The last thing we heard from CDC on multifamily settings was you've got to really look at your own community, your own risk factors, your own cases, and see what makes sense for you. And it really is a very individual situation. So with that, I'm going to hand it over to Janine.
Thank you, Linda, and thanks for going through all of the CDC guidelines that got published. And as Linda said, it is confusing. It's put a lot of challenges in the CCRC Life Plan community space for independent living as a non-healthcare entity. What I've heard from members throughout the country is, just as Linda said, it's varying on what they're doing. They're really trying to figure out, we have this policy that we put in place with masking and social distancing. And so how are we then going to maybe amend the policy or change it? Obviously, for people that are vaccinated, knowing that you have not a registry of who's vaccinated or who's unvaccinated. You have visitors that are coming into the building. You have vendors and maybe delivery people. And then, obviously also you have staff. What I will say is that I've heard from a few members, ones that have really kind of gave some input, and that they have actually made for their staff the vaccination to be a condition of employment, or if we want to say in quotes, mandated. And, I know that's a decision of your organization. That's something that, there are a lot of our other service types, what I'm referring to, our nursing homes that are looking towards moving to that in the next few months. But by using that as part of their as one of the conditions of employment, then they're kind of putting a line in the sand. And then, by that, getting people, vaccinated and kind of having masking continue until that particular date is. The other piece of it we've known is that walking through a community, keeping the policy of having people masked, whether you're vaccinated or unvaccinated. But when you move into a smaller area, an apartment, maybe a congregate area where there's just a few people, if you're vaccinated, you could take your mask off and be unmasked at that point in time. But, what they're doing is really, likely to continue continue to mask as you have people moving through the space, moving through shared spaces, moving through the particular CCRC or life plan community. The other that I've heard is that this has given some opportunity to our independent living to do some ramping up of education. I think that what Linda showed with the red, yellow, and green and the infographics are ways to maybe also use. We know that there are people that are not in the movable middle, but to really work with staff, work with your clients, consumers, your residents, to see, look what has come out from CDC, use that as part of education, and maybe make some headway in changing someone's their choice in getting vaccinated or not. I think the other that I would just, point out is that if you are going to make some changes to your current policies and procedures, or, current mask mandates or unmasking, that you make sure that you communicate to your community, whether that's obviously to staff, to your residents, your clients, your consumers, and then obviously anyone that's coming in. As Linda said, signage, very important, making sure that whether you have something on a website or there's a notice at an entry point, so that people know what the guidelines are, so they're not caught off guard. And it takes some of the pressure, obviously, off staff when they have to either remind or review something, as long as they can point to it or just say, did you see this, or maybe even have something to give to them. So with that, I know that there were, I don't know if there were any questions. I have to come back up onto the screen.
And Jeannie, while you're looking at the questions of the chat, I just wanted to add, because you mentioned visitors, and this is true of HUD housing, and if it's true of HUD housing, I imagine it's true of non-HUD independent living, and that is, you can still set your own visitor requirements, and you can still do what you believe is the right thing to do for your community, as far as screening, requiring proof of vaccination, certainly masking, etc., for any visitor policies you'd like to have.
So I do see in the chat about the inconsistent information. So I think, I know, Linda, you responded in the chat, but just to bring it forward vocally, if people maybe just are on the phone and not looking at the chat or can't see the chat, that there is some inconsistent information between the IL, the independent living page on CDC, and then obviously what Virginia Department of Health is recommending and requiring. I should say recommending.
And then, Janine, there's a question really early in the chat. Tammy says, just to clarify, independent living in a CCRC is not considered a healthcare setting. Is that right?
Right. So, but as Dana put in Virginia.
Oh, I see Dana's response. Okay, sorry.
So overall, it's not. However, it's that could be a state guideline, or in this case, regulated through the Department of Social Services for Virginia. That unless you choose that, then it would be. I'm looking back. Let me just scroll down. I don't see anything else in the chat right now, unless I'm missing something. Melissa, I know you're always looking at the chat, and Dana.
This is Dana. I was just going to say, Melissa and I have a call tomorrow with the Department of Health, and so we will raise the issue about the inconsistency that was raised in the chat, and whatever clarification we can get about that, we will share.
Okay. Thank you. I was going to say, I know that Linda has a housing call every week, and one knows that Dee was kind of putting together an advisory group for life plan communities overall, and then she went off to become a mom. And so we are just getting that group kind of put back together, and we're looking at the first week of June meeting obviously with the holiday coming up and people scheduling. But if you have any questions specifically for, I know in Virginia call them CCRCs, but Life Plan Communities, if you want to reach out to me after this call, I can also put you in touch with some members. And again, it is state specific that I've been speaking to and what they're working on. If you want guidelines or help or just to have a discussion before even we have that meeting in June.
And I'll also note that I know from talking to our members on Monday, a bunch of them have really scaled back really recently, then not in response to this particular guidance, but in response to other CDC guidance, have really scaled back a lot of the extra cleaning and disinfecting they'd been doing. And are using those funds for other uses now. So they're still doing cleaning and disinfecting, obviously, but it's not at all at the same level it was, say, a year ago.
Linda and Janine, I wanted to raise an issue that I've been getting contacted about, and that's the screening for visitors. So the issue that I've been contacted about is, what is the best practice for screening visitors, for any level of care, but independent living as well. So, for example, some communities had a document where visitors are signing in, and then they were interested in adding the question, are you vaccinated? And so in one particular case, we talked about whether from a HIPAA perspective, if that information should be on a page with 25 other signatures where other people could see that information. So we talked about maybe doing half sheets, a sheet per visitor. So I wondered on your calls what you're hearing about what other states are doing regarding that screening.
So, I always kind of err to the side of where I came from, obviously with on nursing homes, and I know it's not the same setting, but those particular sign-in sheets really, you kind of think about what doctors' offices went to, where they had the sticker and they pull off the sticker so that no one can see anything, because any privacy concerns also are the fact that Janine Fink Boyle went to visit Mrs. X. Like that's actually privacy concern too, but you do need to have a log in the organization for many reasons. And so you might want to think about, Dan, I know even moving to a half sheet and adding in the vaccination, it is, it does bring forward the fact that it is saying that this particular person was vaccinated, yes or no, but you're still seeing where the person's going to and who they're visiting.
Sure. Yeah. And I guess I should clarify that was like one sheet per visitor. So it wouldn't be shared with other visitors.
Yeah. Oh, okay. I understand. Perfect. Okay. So, what I would say is that I think that what we've been told on one side is that, it's encouraged to ask have been vaccinated, but there didn't need to be any documentation on that. That comes from the highly regulated side.
Yeah.
Yeah. So I don't, I think that would be in some cases, I haven't really heard from members, and I can put that out there, see if they're asking and then actually documenting for CCRCs, LPCs.
Okay, great. Thank you.
Yep, no problem.
And I would just say, to what end are you asking that? So, what are you going to do with that information? And how is that different from what you're going to ask all visitors to do, right? It might be a lot easier thinking about HIPAA and thinking about safety to continue to require visitors to be masked in all the common areas and elevators, and what happens in a resident's own apartment is up to the resident. So I just, I know from the HUD perspective, HUD's not interested in, you can go ahead and screen, but then, right, how do you maintain that information? Where do you put it? Housing providers aren't necessarily equipped to hold on to that kind of information. So, think about what you're going to do with that information and what's your goal, right? Is your goal really to ask unvaccinated, and what proof you're going to require? And is someone always going to be sitting there at the desk? There's a lot of affordable housing communities that, at least before the COVID, and some still now, that aren't staffed 24 hours a day, 7 days a week. And, how are you implementing any policies you have equitably and equally over the course of a day or a week?
So,
Yeah, thank you. Mhm.
hey, Linda, this is Melissa, and you might have already addressed this. I'm sorry, but I just wanted to reconfirm it. So, one of the other questions we're getting is we're talking a lot about residents taking their masks off and visitors taking their masks off in IL, but what about staff if they're vaccinated?
Yeah, the same thing. Organizations can have their own individual policies for their staff, and the CDC recommendations that came out last week completely allow for that. OSHA has said that they know that CDC has come out with this, and they are, I forget what it was, they're figuring out what, they're going to put something out. They haven't put anything out yet, but for now it is our, firm understanding that individual organizations, workplaces, housing communities can have their own policies for their staff. And, for example, can require masking. As Janine said, we know of some who have instituted or will be instituting vaccination mandates.
Great, thanks. I know that there were some members who have been talking about, I know everybody's been talking about it behind the scenes, and there are members that have already decided what their policy is going to be. I'm wondering if there's anybody on the phone that would be willing to share what their plan is that might help everybody else. You can come off mute to share.
Yeah, thanks, Melissa. This is a really great opportunity for us to share what you're doing so other members could learn.
Good morning, folks. This is Charlotte with Sunnyside and Harrisonburg. We haven't made a final decision. We wanted to hear the update this morning, but what we're considering doing is for the independent living, including our apartment building. If I understood what you said this morning, we plan to allow vaccinated residents to come out of masks. I think we are going to keep staff, even vaccinated staff who work in independent living. I think we'll keep them in masks a while longer. It's a little hard to keep up with a large staff of who is and who isn't. And then I think I'm going to ask the team if they agree that we will keep visitors in masks when they come in the buildings, just because, again, in the independent living buildings, because it's going to be kind of tough just to keep up with, are you vaccinated or aren't you? And I think that would make residents feel comfortable too. So that's, we haven't put it in place yet. I wanted to hear what we had to say this morning, and then we'll talk with the team more, but that's what we were inclined to do during a discussion yesterday.
Charlotte, thank you. Just to clarify, for the visitors wearing the mask in the building, that would just be in all the common areas. Is that correct?
Right. And for independent living only, when they come in of course, our healthcare and AL building, even the bottom floor, which doesn't technically have AL or healthcare, will require everyone to be masked. But for independent living, the guests, when they would come in community areas, we'd ask them to be masked. And of course, when they go into the residents' homes, that's really their business. What they do would be my thought.
Thank you. We do have a question in the chat box. Anyone have further insight on a community who has required staff to be vaccinated? Anyone on the phone have that requirement?
Yeah. So anyway, yeah, I'd love to hear from actually someone on the phone first before I go and tell you what I think I heard.
Okay, Linda. Oh, well, someone has responded here. My mic is acting up, but our residents who are fully vaccinated don't have to wear a mask. We changed our rules for employees. Fully vaccinated independent living employees aren't required to wear masks. We're also allowing vaccinated visitors to not wear masks and to go into common areas. They must show proof of vaccination to the front desk prior to taking their mask off. Thank you for that comment.
Wow, that's a definite change. Got it. Thank you for sharing.
This is Sean at Westminster Canterbury Lynchburg. As of Saturday morning, our independent living residents that are vaccinated can go without masks. Unvaccinated residents need to wear masks if they're in common spaces. We still don't allow visitors into our dining spaces. Visitors do need to wear masks, and as of today, all staff need to wear masks across all levels of our campus. And I see that probably going on for some time. And I think at some point we will let vaccinated staff members go without a mask when we feel more comfortable in independent living, but we'll require unvaccinated people to keep wearing their masks.
Thanks, Sean.
This is Emily McDuffie. I'm from Westminster Canterbury of the Blue Ridge in Charlottesville. We are still requiring all of our residents, whether they're vaccinated or not, to wear masks in common spaces. And all visitors and staff, no matter what their vaccination status, are required to wear masks as well in common spaces. So it seems like we're strictest I've heard so far.
Thanks, Emily. Linda, would you like to share our thoughts that you were going to raise, your thoughts you were going to raise with us earlier?
Yeah, I don't remember precisely what community it was we were talking to. And Janine, you might have been in this conversation too. But LeadingAge does certainly have members, non-healthcare members, who have taken the step to require their staff to be vaccinated, and it comes after really trying lots of different ways to encourage staff to get vaccinated. And I think the success has been really good. And on the whole, staff stay with the program. And the thing about independent living versus healthcare is that there are far fewer staff in an independent living setting than in a healthcare setting. And but those staff often have pretty high touch contact with a lot of residents. So we do know it's happening. I expect we'll see more of it in the coming months as as more and more people move out of that wait and see mode into the vaccinated mode. I don't know, Janine, if you have anything to share, if you remember in particular the one of the communities.
I do. So there's a community in Maryland, right around the Baltimore area in Towson, that has the mandatory vaccination, but they have a deadline. So they had given some leeway to their staff, and their deadline is May 31st. And so that community, is working, more towards, I don't have their percentage numbers for staff, but they're, giving some time for staff to obviously be educated, to kind of discuss if they're if they're deciding to not get it right now, but they have an end date. So yes, so I do know of a community in Maryland.
Yeah, this is Melissa. I know of a community that operates in multiple states that's going to adopt a mandatory vaccination policy within the next 2 weeks. Again, like you said, Janine, with an end date to be determined. And I do believe we have one provider that I know of in Virginia that has enforced a vaccine mandate. And as far as I know, they didn't lose staff because of it. Now, I don't know what the fine print is on these, right? So what the caveats are for them. But I think as we start seeing more and more folks adopt this, hopefully we can get their policies and share them with everybody.
And I know there's a lot of concern about, losing staff, right, who don't want to comply with the mandate. But I also think we could look at it as a staff retention policy, right, where, the staff you do have who have been vaccinated, I think it's going to be a lot easier for them to come into work knowing that everyone else has the same vaccination. And here's Robert in the chat saying they have a mandatory vaccination policy and have had no major issues.
That's right, Robert. I remember you've had that since the vaccine came out. Would you mind coming off mic and talking about that?
Yeah. Hey, so I think the biggest thing for us was, which really goes back to the education and knowing that there were going to be some people with some legitimate medical exemptions. For example, I can think of two that had previous issues with Bell's palsy, and certainly we had those considered as legitimate. We've had a handful of others that had doctors that had asked them to delay the vaccine, and so we followed up with them after that, and the majority of them have now chosen to get it. So I think we have less than 8 staff now that haven't been vaccinated, and all of those we would consider probably long-term legitimate exemptions that I don't anticipate that they will ever be able to get it. So that's something that we're going to have to look at in the future as to whether or not there's going to be some specific restrictions for them. So that may be interesting.
Thanks, Robert. Any other questions or comments around these issues?
I did have one thing for, I think it was Sean at Westminster Canterbury Lynchburg for the, it's interesting, the change for the independent living. What happens for them if they're going in an area for, say, your assisted living and skilled care residents? Are they commingling with them and those residents are having to wear their mask while they see the IL people are not wearing theirs?
So we don't have a lot of commingling still. We have some assisted living that are trickling over into independent living areas, but all of our residents across the campus are maskless for the most part, I would say. If a person goes over from independent living to assisted or into healthcare and visits, they have to have a mask on. If they go to our clinic, we interpreted the guidelines that if you go to a doctor's office, you still need to wear a mask. So in the clinic, an IL person needs to bring their mask. So there is still times where people need to keep them on. I feel like I'm in this gray area, and just we're trying it and doing the best we can. Have about 98, 99% vaccination rate amongst our residents. So feel pretty good about the vaccine and how that's going. I'll tell you whether I'm right or wrong in about 6 months.
We have a question.
Thank you.
Oh, thank you, Sean. What if you have numerous unvaccinated team members working in independent living? Has anyone made specific adjustments for this? Sorry, Tammy, we don't have any feedback for you right now.
Yeah, and I think that's precisely what we're talking about here with thinking about a vaccination mandate, certainly continuing masking for those employees. And, and Janine, I'm sure you'd agree, really figuring out some one-on-one, education of those team members about the benefits of vaccination if you're not going to go, even if you, I guess, if you are not going to go ahead and have a vaccination mandate.
Yeah, and I can tell you that from some of our members, we've heard that, and just as Emily just wrote in, that's why they're continuing to have staff be masked, especially in the common areas. And the other piece that I heard is that some of the in your dining area, in any of your food services, that some of those staff members are might be below 18, or just around 18, and just might not have gotten the vaccine yet. So they're keeping them all masked.
Janine, a question. If they have a medical and a religious exemption, are you requiring them to wear masks like a lot of places have done during the flu season? Any thoughts about that from folks on the phone?
Well, if they have a medical or religious exemption, that means they're not vaccinated. Therefore, they would have to wear a mask, correct?
Yes, yes.
Okay. Well, we still have a little time left if there's still discussion on these matters, or we could wrap up early.
There's one more question in the chat now from Robert about guidance expected from DOH or DSS in the near future. And I guess since you all have a meeting soon, you might hear more about that.
Yes, I mean, the Department of Health has released a clinician memo on Friday, basically just providing some updates to guidance from the CDC, but we will be working with them and providing any clarifications that we can receive from them. DSS is a little harder. Typically, we find that they follow the CDC and the CMS recommendations.
And Janine, are we expecting any big, like major recommendations like this for non-healthcare settings from CDC or CMS for healthcare settings? Is that what we?
Well, so my about 2+ weeks ago, and I think that I also was on a LeadingAge Virginia call. I said that we put a lot of questions to CMS and CDC. Obviously, had to do about privacy and HIPAA and masking and unmasking. It was before the CDC dropped what they did, and both responses we got from CMS and CDC was that they were looking at not. They did not say changing. They said looking at the questions that we brought forward, which came obviously from members, but that there wouldn't be any changes for a few weeks or more. And that was 2 weeks ago. Which would be very specific for healthcare settings.
Mm-hmm.
Well, we'll continue our conversations with the Office of Licensure and Certification and DSS, and we will get that information out to you all as soon as possible if we hear of any additional clarifications. Okay. Well, hearing none, I think we will finish up a little early. I will give another opportunity for comments or questions here, but okay, well, hearing none, thank you all so much for joining us today. The recording will be available in our newsletter tomorrow.